In this last section, we'll summarize what we've covered in this module. There are many, many other issues related to the FDA and its regulation of products that we did not have time or space to address. Among these are the challenges of post-marketing surveillance and drug safety more generally, the monitoring of drug advertising and marketing, and the regulation of over-the-counter drugs, dietary supplements, and herbal remedies. There are many others. The website at fda.gov is a user-friendly portal that links to all aspects of the FDA's work. An excellent overview of FDA basics is available that includes videos, webinars, links, and many pages of questions and answers. Daily Med offers up-to-date drug labels or package inserts, as well as marketing status. At the FDA website, Drugs at FDA, you'll find a searchable database of all approved drugs that includes each drug's history with the FDA. Finally, on the bottom of this slide is a link for advocates who would like to be involved with the FDA's work. To briefly review, in this module we've discussed a number of key concepts. We've looked at how medical products are regulated, with a focus on drugs and biologics. After a review of the history of regulation in the United States and the laws that govern the regulation of medical products, we examined the role, scope, and function of the FDA. We attempted to rectify the widespread myths and misunderstandings about the FDA by taking a look at how the regulatory process actually works. In the process, we covered some common terms and processes of drug development and regulatory law, touching on some of the most common controversies and tensions that are an inherent part of drug regulation. We examined the FDA's role in safeguarding the public both before and after products are marketed. We briefly looked at the limitations of current methods for gathering safety data post-marketing. Using cancer as an example, we defined clinical trial endpoints as the way the FDA determines if a new drug actually works, and gave an overview of the drug development and regulatory process. We examined the role the FDA plays in determining when evidence of clinical benefit is sufficient, and how clinical benefits are weighed against the risks or harms of a given treatment. Finally, we took a look at the growing issue of off-label marketing and drug use. As real-world examples, we saw how public health catastrophes have led to the legislation that permits the FDA to play the role it does today. We also discussed the story of the angiogenesis inhibitor Avastin that illuminates many of the complex issues and dynamics that are part of cancer drug development and regulation. In offering a history of FDA regulation, in combination with a real-world example from today's high-stakes world of cancer drug development, we hope to have shared a sense of some of the repeating dynamics of drug development and regulation, conflicts that are often easier to comprehend in their historical contexts than in the heated light of contemporary debate over access and safety. We've tried to convey the sense that regulatory practice involves both evidence-based science and a negotiated social process whereby forces in society determine what they most value. And we also offered a glimpse into the important roles that political will and commercial interests and incentives have played and continue to play in determining how the laws will be made and especially how they will be implemented. As citizens, advocates, patients, and healthcare providers, we each have important roles to play in the regulation of drugs and the other products that impact our health. As far as I'm aware, FDA is unique among regulatory agencies in the world in its policies regarding transparency and openness to public comment. On a personal note, I can say that FDA employees, from division heads to reviewers, from physicians to scientists to statisticians, are some of the most caring, dedicated professionals I have ever met. They deserve our recognition for the difficult job of protecting the public health that they do, with scarce resources, despite the changing political and social climate in which they operate. This is Musa Mayer, thanking you for listening to our module, FDA and the Regulation of Healthcare Interventions. We hope it has been helpful, and we welcome your feedback.